experience with chondrosarcoma?
Hi everyone, so I'm Danielle King. I'm 38 years old. When I was 32, I was diagnosed with chondrosarcoma in my right thigh. It was attached to my femur and was growing up to my hip. Chondrosarcoma, most people probably know, but it's bone cancer, including your cartilage. So there's some photos of my family, which have been everything and got me through it. A bit of history. I've always had bone pain. I've always really struggled. Hips, legs, falling over a lot, lots of injuries. I was very sporty. Numerous trips to the doctors, was always told it was growing pains. When I was at junior school, my left leg completely locked one day, just out for no reason. Got taken to hospital and was told I had a bone spur, an extra bone, which was a little bone spur, and it had just slightly grown too long and locked my knee. Had to have surgery. My mum was told it was completely normal and that I just had extra bits of bone. Nothing was done to follow up with the doctors. As I say, kept getting pain ongoing, just normal. So that's called multiple osteochondromas, also known as multiple hereditary exosis. And so it's little bony spurs grow and they can get cartilage cap. Now it needs to be monitored because the cartilage cap can actually turn malignant, which is what happened in my case. I had a lot of pain in my right hip. A couple of years before my diagnosis, it got quite bad. I thought I was just a bit run down. So the symptoms I had, deep hip pain at night was unbearable. I used to go into the sofa and have my leg literally up on the side under pillows as I couldn't sleep. Very tired, bruising a lot, was very sick for no reason. Started to lose my taste. It was really odd. Could only taste sweet and spicy things, which was strange. Used to get really, really over the top hot at night for no reason, even if it was freezing. Bone pain became all over. Started limping, and I started getting a swelling in my right thigh. We used to joke that I missed leg day in the other leg because that was completely normal, and then I had this huge. But it didn't hurt, so I didn't really worry about that other than my hip. I know there's the typo's been sorted, thank you. I looked in my old one, there was a typo. One of my dogs, Dave, he wouldn't leave me alone. He kept digging my leg all of a sudden, crying, very protective. Even when my other half leant to kiss me goodbye, started growling, and that just wasn't him. One day nearly made my leg bleed. He was scratching it so hard, it's like he was trying to dig. I made a bit of a, well, I wouldn't say joke, but I said, oh, dogs can sense infection and cancer. It stuck in my raft on my mum's head. So I went to the doctors, and that's where he saw it and went absolutely ballistic that I'd left it so long, asked how long I'd had the swelling. I'm just gonna, before I go on much further, I just need to mention this. One of my younger sisters, Joanne, the year before this happened, passed away from a different rare cancer, adrenal cortical carcinoma. So when this was all happening, I was obviously grieving, as was my whole family. She passed away on the 16th of August 2016, leaving her 1-year-old and her 5-year-old behind, Jake and Molly. And I think I sort of shut off how unwell I was feeling. I sort of put a lot of it down to grief, which I think is quite normal. I just wanted to mention that. Right, so my diagnosis, my GP, I was very lucky. He'd seen one case of sarcoma before. So when he saw it, he was absolutely gobsmacked and wanted to send me for an urgent referral. Still had to go through the 2-week wait. He told me if there was any changes that weekend, I needed to immediately go to A&E. That happened, my legs swelled, I couldn't get my trousers off while I was at work. So I got taken to A&E, was told that I was wasting their time by the triage staff. They took some stats and suddenly said, hang on, you're not very well at the moment, I don't know what's happening. Done some x-rays, 30 senior doctors were all called into a room, I could see them all around there, and only one suspected cancer. As you can see, how huge my leg was. It was so noticeable. So they did, got referred to Stanmore, where I had a biopsy. And they did about 15 sites because the tumour was so large. I got told it was barely cancer. This is by my sarcoma nurse and my specialist. Not to worry, barely cancer, it's mainly benign. So I asked them what to expect, and was told, don't worry, we're going to be with you for 10 years anyway, we're going to get this out, everything will be fine. It's only low grade, we're just going to do basically a wide resection and limb salvage. Surgery. Surgery took around 8 hours at RNOH. Limb salvage, I removed the tumour, took some of my femur. I was told that they weren't going to do a femoral replacement because the way they put it, it'd be a morbid operation for such a low grade tumour. I asked them what would happen if it was grade 2, and my surgeon went, which is always concerning, but I trusted him. Had my nerves cut, my quad removed. I found out afterwards that the tumour split in my leg during surgery, because I found this out because I've got an extra scar. And I asked what it was, and they said it fell apart, so we had to cut, get some more tissue and wrap around. I said microscopic clear margins, found that it was grade 2 and becoming highly aggressive. It was 20 centimetres by 10 by 7.9. Sorry, in advance, I should have warned you first. There's some graphic photos, that's one of the photos of my tumour. The surgeon took it for his portfolio. As you can see, a little bit nasty, sorry about that, after everyone's eaten. Recurrence, started getting similar symptoms. Again, my dog started. A few of you know Nicholas Kalita. He was on at me to get my histopathology records, which I did. In that I found there was a positive margin left on my soft tissue, where the pain was. So I went back to the surgeon and was told not to be silly and to walk properly. This was when I was only just allowed to bend my leg, and dismissed. The next time I went there to go and see him after physio, he'd left to Australia and not told me. So, new surgeon overheard me having a bit of a meltdown, saying, look, I know something's wrong. And he said, do you want to be my patient? And took me on. He listened to me, he looked at his pathology, saw the tumour split, and said, right, you're my patient now, that's fine. So immediate MRI, they had 2 sites of recurrence, one on my femur, one on my hip. I had surgery 15th of January 2019. The 2 tumours were exactly the same histopathology, so they started at grade 2. There was hardly any grade 1 in there. We managed to do it, not a bad surgery, went for the same scar, and it was about a 4-hour one, that one. He managed to get microscopic margins, which I did confirm with histopathology before, but he was great. Okay. There's some lovely photos, that's after my second one. As you can see at the bottom there, that's where he'd gone through, so it's just in my old scar, so a much easier recovery. So I wanted to talk a bit about mental health after, especially a rare cancer diagnosis. When I'm talking now, a lot of people think I'm a bit blasé about it, quite cold when I talk about it. I realised with some counselling that this is me completely masking it. I used to say it must be horrendous for my family, my mum especially. You know, I won't know if I'm gone. I'm not going to know, so I'm not going to worry about it. I didn't really feel like that, and I don't. I kind of disassociated myself, so when I'm talking about my story, it kind of hits home, this is actually about me, and I'm sure a lot of you do it. So I refer to my leg as my surgery leg, and my good leg. It's, you know, everything's sort of disassociated. My family have been amazing. My sister moved in with me afterwards because I couldn't do anything for myself. My mum, I'm living with my mum now to help me with my sort of mobility. And I got my uncle, very close, he had liver cancer, so we kind of used to talk late night about that. My good friend Dan King, I actually went to school with Dan. He had synovial sarcoma, and Nicholas Kalita was the first person, chondrosarcoma patient I ever met for an online support group. So we used to talk late hours, and he used to look at all the medical stuff and explain it to me in layman terms. Right, so I'll go to 2020, COVID hit, lockdown started, like everyone, not doing much, and I started to feel very unwell again. Constant sickness, I couldn't keep anything down, bruising, really tired. My cancer consultant said, look, you need to get checked. I had some other internal stuff going on. She said, we need an ultrasound. So got sent to a clinic. The radiologist jumped back and went, while they were doing an internal scan on my stomach. I was 5 months pregnant. So I panicked there was a huge tumour by a reaction. I was just a little bit of background. I haven't been able to have children my whole life. I was told it was never going to happen. Then decided we weren't going to anyway because of my bone disease. There's a 50% chance of passing it on. So yeah, pregnant, 5 months. didn't think that was possible. So that's why I was so unwell. Last 4 months were awful, so I'm glad that I only knew about it, short pregnancy, very ill. Booked in for an induction on Boxing Day. I really wanted a natural birth, but Sophie decided, as some of you have met her and some of you know her, she'll do what she wants to do. And after 5 days of induction, Sophie was born by caesarean. There's some little photos of my cheeky mum here now. Yeah, she's really changed things for me. As you can see, she's very good fun. So this is going to be hard for me, this part. 2 days after Sophie was born, my uncle Mick was in the Philippines and he passed away. We knew it was coming, but not that soon. And that obviously did a lot of damage to us. 2021, my friend, so I met Dan, I knew him at school. It was a year below me, and we used to laugh. Bar 2 letters, exactly the same name, same school. He had synovial sarcoma. Now you can see this inspirational man. That was after a massive lung and back surgery, doing the 3 Peaks challenge. Yeah, amazing. He sadly passed away in 2021. So now we all know Nick, well, most of us. Last year, that's from last year's conference actually in Watford. Yeah, July last year, we sadly lost Nick. So as you can see, quite a quick succession. I lost my core cancer support group, is what I like to say. The ones I talk to at 3 and 4 a.m. Are honest with, like, this doesn't look good, does it? No, it doesn't. Rather than everyone trying to sort of make people feel better. I'm always trying to make other people not worry about my diagnosis, and I think that a lot of us do that. Try and sort of be cheerful about it. And so yeah, just wanted to then. My beloved dogs, Chaz and Dave. Dave is the one that found the tumour, if you remember me saying. He died last year while I was at the conference from cancer after lots of different treatment, and then Chaz, his sister, 3 months from the same cancer. So I just wanted to get that in. My babies. That's Dave laying against my surgery leg, and that top one, and then pulling out Chaz laying on there. The David's the blue one, the big silly face. Chaz is there. Right. Now there's something to talk about. Look at here, Sophie, that's my little one there. So the impact of being a mum with mobility issues. I've got a lot of mobility issues, as I'm sure we all are, depending on the day as well. Sophie doesn't understand. She understands by helping me up and things like that, but she's only 2.5, so it's quite difficult for her. I've got a lot of guilt about not being able to run and play and get on the floor. She likes to rough and tumble. Some days I can't. Some days, like I suppose a lot of us, I can't get out of bed till a bit later, or but she's kept me going, and she's given me a completely new purpose. So now I've been diagnosed with fibromyalgia as well, and I'm not going to lie, that's actually kicked me more than the cancer. Chronic pain, I've got some neck and spine degeneration. And I wanted to just point out that obviously after a cancer diagnosis, especially an orthopaedic one, it comes with so many other issues. We walk differently, it creates other mobility issues. And I went to my cancer specialist for my 6-month check last week, and we found I've got a couple of exosis, the bone spurs on my good leg, but there's some changes there, so they need to be watched after being clear for coming up to 5 years. So that's a little bit of a kick, but we're going to keep an idea. So I just want to let everyone know, I want to talk about the mental health thing. I just think it's important that we look after ourselves. I was actually speaking to Valerie about this earlier. I think it's really important to be kind and just take some time to relax, and she was agreeing with me to actually take care of ourselves and focus on how you are really feeling. I try and help others. I help run a conscious sarcoma support group. Things like this obviously really help us all. And I'm in the process of creating a special fund joint with Nick Leiter's widow, in Nick's name and in mine, to raise some money for conscious sarcoma and much needed awareness. So, my little one's there, and I think she's going to just come and say hello to everyone. So if anyone's got any questions as well, I'm happy to answer. Sophie, come see Mama. Hello, Papa. There we go. Say hello. So this is my little angel that wasn't supposed to be here, so I just thought I'd introduce you all. Right, you ready? Yeah. Go, perfect.
Yeah, you can answer. She's going to stay.